Good
Good
morning.
morning to you.
How are
Hello,
you?
King.
Hope you're having a good day. I'm sorry, I'm trying to admit some people. It's already 11. My name is Martha Kagwiria, and you're very honored to have this webinar today about prostate cancer. Awareness, prevention, and how to manage if you already have the disease. We are honored to have Dr. Bernard Samia from Mpisha Hospital in Nairobi. He's going to take us through how we can manage it and how we can prevent from getting the disease. Dr. Samia, good morning. You're muted.
That's better.
Yeah.
Okay, thanks. Good morning, and
It's good
nice
to have you in the house.
today. Thanks.
Yeah, sure. So I don't take a lot of time. It's already, I've taken 1 minute with the introduction. So I'll hand it over to Dr. Samia. At least we can have a maximum time to learn from him about prostate cancer prevention and management. Welcome, Dr. Samia.
Thanks so much. I'll just try share my screen. Thank you. Just confirm my screen is on.
Sorry, the screen is on, but you can enlarge it.
I'm actually on screen.
Or you can put it as a full screen.
Perhaps
69, I can see 69.
I'm actually on slideshow.
Okay.
I don't know which other option to use because I'm on slideshow actually.
That's okay. That's fine then.
Okay, so I'll start. Thanks so much, and let me welcome all those who have logged in this great morning, September. As we are all aware, is a great month where the international community comes together to just put together efforts in educating, combating, and just trying to tackle some of the big cancers that affect the male gender, this in particular the prostate cancer. So I was asked to give a talk on this, but I thought I could just debate a little, handle a few issues about the health of men in general, and I know one particular concern is usually if men are more vulnerable to diseases than women or not. I'm just trying to address some of those issues. And then I'll handle diseases of the prostate, as we will be aware that the prostate is not affected just by cancer. There's also this milder disease of the prostate, which we call benign prostatic hypertrophy. That affects just as many men, probably more men than the cancer. Sometimes it can be a precursor for causation of cancer. Then in my talk, I've also just sneaked in a little 2 slides on some common diseases that affect men. This is diabetes and heart diseases. And we'll conclude by just seeing.
Sorry, Dr. Samia, you're on mute. Dr. Samia, you're on mute.
Okay, that's better.
Yes.
Hello.
Yes.
When did
now.
When did the mute start?
When you started talking about some diseases of diabetes, I guess.
Okay. Actually, somebody must have muted me because I didn't touch my screen. Sorry. So I'll be talking about some common diseases that affect men: heart disease, diabetes, and so on. Then, particularly, we look at prostate diseases and common mitigation pathways. Just as an introduction, I'm Dr. Bernard Samia. I'm a consultant physician, cardiologist. What a physician does is a specialist doctor who deals with diseases of the adult population. So adult can be a very vague term, whether we have our 14-year-olds called adults or we leave them up to 18 years. Sometimes we have that gray area, who goes to the pediatrician and who goes to the adult doctor. But we do take care of such people. So diseases of men, women, and so on. But particularly today, we want to look at diseases of men. The other thing I would like to encourage is those who are logged in, please feel free during my presentation if there are any issues to clarify on, or if you have certain questions that you may have wanted to ask in any medical forum, please feel free so that we can share that. I'll have a very short presentation and then reserve the rest of the time for discussion. So just as an introduction, we understand what is called the male gender. This is defined by genetic mechanisms, what we know as the XY chromosome. So the genome for a man usually inherits an X chromosome from the mother and the Y chromosome from the father. Those who traditionally have blamed their wives for bringing forth to girls alone and not boys, I think usually good to understand that this Y or the male factor actually comes from the father. So time you started taking up the blame. There are sex steroids during development of the fetus, and these particularly androgens that create the mass. Am I okay? Hello?
Yes. Yes.
Yeah,
Yes.
okay. So the androgens that characterize the development of the masculine gender, and the estrogens that are purely responsible for the feminine gender. So the balance of these hormones is usually very important in the development of human being. We have the genetic human being, whether it's XX or XY, but then we also have the phenotype or the physical human being, which is determined so much by the balance of these hormones. What has been shown for a long time is that men suffer from slightly more illnesses than women, and the understanding is quite complex, whether actually the female sex is more resistant to diseases and so on. It's not quite clear, but the patterns show that men suffer from more diseases. Men world over have a lower life expectancy and many other issues, suicide rates and so on. So man is actually a very vulnerable gender in society, as we'll get to learn later. Now, the masculinity or manhood or manliness, we call them as a set of attributes or behaviors. And this is usually characterized or brought about by what the society expects, what we call socially constructed. But we have some behaviors that are considered masculine that are actually dictated by the biology, by that XX, XY, and the hormones. And so this brings us to what we call biological male sex, and then we have the masculine male. There's a lot of discussion today about transformation or transfer of gender from male to female or the other way around. They're very complex issues, both at biology level, at society level, at what we call human rights level, and so on. Difficult things to understand, but what we've known traditionally, there's the genetic sex, then there's the masculine sex. In between, we have a lot of crossovers. So what is unique about men? In most parts of the world, men access health services less frequently than women. And this is unrelated to differences in need for medical services. What we mean here, men might actually be requiring more medical services, but the unfortunate thing is that they actually do not access those services. Some unique things are men are more likely to smoke, drink alcohol, and generally lead less healthy lifestyles. They're more likely to put off routine checkups, delay seeking healthcare provision for symptoms of health nature. It's not uncommon. The headaches, the pains, and so on have been going on for very long, and they're just not going to seek health. And what has also been shown, working men are less likely to have regular doctor insurance checkups and so on. So all these are really, really negative issues, and they put men in a very precarious situation in terms of picking diseases early, diagnosing, and even management. What is even worse at health management level, healthcare system, there is actually more money spent on healthcare needs of women and children. A lot of groups out there, non-profit making organizations, government organizations, and programs actually have a lot of their work geared towards the improving the health of women and children, to the extent that it's kind of the male gender is neglected to some level. Men are more likely than women to be working full-time, or obviously this puts pressure on their mental health and even time to relax and go seek medical attention, and even just to recover from the stresses of work. Men are traditionally encouraged to do high-risk jobs that are stressful. If you walk out there, you look at all the people who are digging in mines, the ones who are on the construction, the Western superhighways. Here I can see from my window here, all the guys who are up there carrying the heavy metals are men. Whenever you hear bridges collapse somewhere, it's actually men who have been who are affected, because they're the ones out there doing all these dangerous things. And back from culturally, men have been encouraged by culture to be tough, to be independent, and they even feel visiting a doctor or complaining about an illness is actually a sign of weakness. So all these are really, really unfortunately negative things. I'll be talking about the prostate diseases, but I just wanted to sneak in some 2 slides about these common diseases that affect both genders, but particularly a disease like diabetes for men. We know diabetes simply refers to elevation of blood sugar, and symptoms are usually very gradual and remain undiagnosed for a long time. One of the key things of diagnosing a disease like diabetes in men is the urinary habits. You find the pattern of passing urine to some extent has changed. There's what we call frequency or increased rate of passing urine. Whereas one used to pass urine at night, maybe not wake up at all during the night hours to pass urine, you find this individual is now waking up once or twice to pass urine, has increased thirst, has increased appetite, and so these are usually very subtle, very mild symptoms of developing blood sugar problem. There can be a lot of crossover of these symptoms with the prostate disease, so one may not actually be able to tell the difference in the early stages unless you go for a check and have the blood tests done. And there's also increased risk for heart diseases and early death that are because of diabetes. So it's something that we really need to put in mind and have the correct measures, screening and diagnosis. So quick features for this increased sugar would include frequent urination, increased thirst, feeling tired, weight loss, itchiness, especially in the genital areas, and slow healing of wounds, blurring of vision, low libido. One of the nice things about getting men to get into hospitals and have checkup is if you are going to control their libido, then they will be motivated and come for checkup, where this is a carrot we like dangling for men. If you're actually going to pick up positive impact in terms of their libido, they'll be happy to come and institute whatever measures you want. So we like to educate, we like to encourage exercise, we like, especially in terms of nutrition, to encourage low carbohydrates, low sugars, increased intake of vegetables and fruits. And of course, there are a lot of medications that are prescribed by clinicians for management of sugar problems. Just mention one other common problem, heart diseases, and there's a big spectrum of what we call heart diseases, and they generally occur because of certain risk factors, and One is likely to have a heart disease out of having high cholesterol levels, having high blood pressure uncontrolled for a long period of time, having diabetes, being obese, smoking cigarette. Here we don't even talk of small or big amounts of alcohol. I mean, smoking, any smoke is bad, whatever level you're consuming. Unlike alcohol, where we tend to say little can be good for your heart, excess can be dangerous. Physical inactivity is also bad. Increasing age is a risk for heart diseases. There being other family members who have heart disease makes you as an individual also at increased risk of getting a heart disease. So these are generally risk factors for development of heart diseases. And these diseases come in various forms, but common from an individual point of view, you may present with chest pain or difficulty in breathing, and some dramatic presentations would include a heart attack, where there's a sudden collapse or loss of consciousness, or even sudden death because of heart attacks. So we usually do not like individuals to be undiagnosed until they get to the stage of a heart attack at the first diagnosis. Those who already have the diseases may still have heart attacks, but we are usually better equipped to manage them if we already know what they've been having. Other heart diseases may include abnormal heart rhythms, just the heart beating too fast, or too slow, or too irregular, and this may cause the individual to have certain limitations in daily life activities, and that these are all important to look for. Just to take a little break, and then we reflect on the cancers. So from the lay point of view, what we know, what is a cancer? Cancer simply is excess growth of a certain tissue in the body, and more or less any part of the body can actually undergo this excess growth. The body has usually a mechanism of containing the growth of various tissues, so that we don't have abnormal growth that may affect function. Because of certain reasons, the body may lack that check mechanism, and we get an overgrowth of certain areas of the body, and this is a disease process. It may be restricted to that area where it has originated, or it may spread to other areas and obviously compromise the function of any of the other parts that have been affected. Why are we getting more and more cancers diagnosed today compared to 5, say 10 or 15 years ago? No single reason can explain this, but we think the what we've considered as risk factors for cancer may be getting a lot more and more in society. We're getting more overweight people. Obesity is out there. Look right out the window, you'll see more and more obese people. These people are probably putting on a lot of weight because of diet issues. So high fat diet, low fiber diet. They're taking a lot more alcohols than previously what was done some years back. Maybe their economic status and so on is better. They can afford. There's a lot more physical inactivity. We have a lot of transition in terms of physical activity, where people would only use personal vehicles or public transport, and the rest would be walking. A majority right now are not walking. Those who can't afford own vehicles or public transport are using boda-bodas. Actually, the introduction of the boda-boda has really made a big shift in terms of physical participation in physical activity of populations, not just in the urban areas, but even in the rural areas. People do not walk anymore. They are all hike a ride on some motorbike and get much faster to where they want. All these are going to have negative impacts on society in the long run. We're going to have a lot of obese people, and this in itself is a risk factor, not just for cancers, but even for the earlier diseases I talked about, diabetes and the heart diseases. But for purposes of discussing cancer, we have this. Now, there's a big issue about exposure to chemicals, or what we call carcinogens, cancer-causing toxins. every day in society. People working in manufacturing industries, they're exposed. We are eating foods that have been grown with contaminated water. There's a lot of use of fertilizer in the growth of foods that we are consuming. And all these factors, I think in the long run, may actually affect the causation and the prevalence of cancers in the society. Something about cancers, what has been shown is that 30% of cancers are curable if detected early.
Sorry, Dr. Samia, we are still under slide 2.
You didn't move along with my slides?
No.
Oh, what's going on? Because I'm moving my slides.
No, we are there 30%.
Okay. Are we here 30%?
Yeah, on slide 12. Maybe you can go back just for everyone to follow, so you can maybe go back.
So I had talked about diabetes. You can see that slide?
Not yet.
Which slide can you view?
12.
What does it read? I don't have the numbers.
30% of cancer are curable if detected early.
Yeah, I'm okay with that. That's
great.
Yeah. Are you okay there?
Yeah. But for the purpose of recording, that means you've missed the previous slides. Maybe you can go back.
Okay.
Sure.
So you can see my slide on 30% of cancers?
Yes.
Okay. So what has been shown, if cancers are picked early, they can actually be cured. And cure is a very dangerous word to use when it comes to cancers. As from the medical perspective, we really need to be careful when you use the word cure, because cure means that you have removed the disease completely from the body system. A lot of people have actually been diagnosed with cancers, given treatment, and been told that they're cured. But we know too well that they are usually still malignant or cancerous cells still circulating in the body, and many years later they may come out and manifest again as a disease in the same area or another site of the body. So we usually need to be very careful. If one is told that they've been cured of a cancer, they still need to do routine checkups and not sit back, relax, and think that was it. But generally, the earlier the cancer is picked, the more likely the cure can be achieved. Also, up to a third of cancers are treatable with prolonged survival if detected early. So here again, treatment would refer to maybe retarding the growth of that cancer, managing symptoms, and improving quality of life for that individual, and not necessarily achieving a cure. So again, early diagnosis, detection, and treatment is important. Then again, a third of cancers can be provided with adequate symptom management and palliative care. So this is usually the extreme end down. We'd like to start with the upper part where we pick them early and cure. If not, at least treat and improve survival. But in the long run, when we pick them late, then we can just do symptom management and palliative care. What has been happening in Kenya? I don't know, my slide has moved.
Still under 12? Not yet.
Oh, so now I'm not sure how to do this, because what my current slide is showing the Kenya scenario. No. Okay, can I okay, this will take me a bit of time. I send you my slides, then you move from your end if that can move them real time.
Yes.
I don't know how long that will take, so just quickly just send me your email on my phone quickly so that I send them to you.
Right away. We are on Kenya scenario, but I'm sending you my email address. You can go on.
Okay. So you can see the slide on Kenya scenario.
Yes.
Okay, so some data published, this should be about 2019-2020 data, showed cancers as the third highest cause of death in the country. We have what is traditionally called non-communicable diseases. Of course, cancer is included in this, but more so we usually look at heart diseases, diabetes, and strokes, and so on. They actually take the lead, then cancers quite strongly following. The leading cancers that were analyzed at that particular time, we have prostate and esophagus cancers in men. We have breast and cervical cancers in women. These significant numbers that were recorded in the last 5 years or so. And one particular aspect that was noted during the development of that paper was the late diagnosis of most of these cancers. What are some of the reasons why these cancers are diagnosed late? Lack of awareness. We generally have many people who have symptoms do not go for medical checkup. By the time they are going for the checkup and diagnosis, it's pretty late. So that lack of awareness. So we're happy to have a forum like this today so that we can just educate each other about some of the things we call routine screening. Even when there are no symptoms, when you're of a certain age, you should generally have a checkup of this and this and this aspect of your body. The symptoms may not have been there, but one can easily pick a disease if it's developing. Then there's inadequate diagnostic facilities. Many of the rural populations may have the desire to have checkup or screening of some of these diseases, but when they go to the health facilities, the capability to do the diagnostic test is just not there. We understand the setup of the healthcare system in the country, the public healthcare system, where we have the various levels from level 1 all the way to level 6, being the referral facility. And there is a provision for certain type of services that can be provided at each of these levels in the diagnostic capability, including the technical capacity of the personnel who man the facilities at those low levels. So usually better for those who have access to the higher levels, level 4, level 5, level 6, you're likely to get a lot of these facilities and diagnosis given. Unfortunately, for those who rely mostly on level 1 and 2, they will miss out a lot. Lack of treatment facilities, even for those who may have the diagnosis given. Again, depending on where you're attending, the low-level facilities may not have the capacity to offer the desired treatment for the various diseases, including cancers. Now, of course, there is the high cost of treatment. We understand the healthcare system in the country today. A majority is you have to pay out of pocket to access healthcare, and the poverty index, as we understand the last few years, especially with the COVID scenario and so on, things have just gotten from bad to worse. So many folks out there are not able to actually afford healthcare, and this would cut across mitigating, I mean, the negating the likelihood of diagnosis, likelihood of treatment, likelihood of good quality care, and improving livelihoods and so on. So unfortunately, high poverty index again. So all these factors really not just affecting the poor management of cancers, but many other diseases in the country. So the prostate gland, please confirm me that you can see my next slide, written prostate gland.
Not yet.
You're still on Kenya scenario?
Yes.
Okay.
I think if you press F5, it might help.
Someone is helping you?
No, actually, what I was thinking, I could send you my slides. Maybe this should take me a minute or so. Let me send you my slides, then you can move them from your end.
Yeah.
Okay.
It's now projected.
It was such a huge lag.
Get slides to save time. In case it hangs, I can assist.
Just try pressing the F5 button and see what happens.
I'm using the forward button. Then it's F5. Moving on my end. It's just I don't know why from your end then it does not move. Just 1 minute. I will send this to you now.
Okay.
Okay, so okay, you got it?
Yes, I got it. 1 minute. Apologies for the inconvenience of viewers. We're on 13, if I'm not wrong. 14. Confirm you can see that, Dr.
All right, so I can continue?
Yes, please.
Yeah, so the prostate gland, what I have interest to talk about, it's a little tiny thing here in the male gender, where the urethra that passes urine from the bladder to the external, the prostate encapsulates or goes around the urethra. So with age, this organ continues to grow, and it may have abnormal growth to the extent that it actually obstructs the outflow of urine from the bladder. This growth may just be increase in size of the cells, and they cause obstruction or obstructive symptoms, or this growth may be related to transformation of the normal cells into the cancerous cells, and this is where we have cancer of the prostate. So the symptoms in that case would not just be because of the growth, but cancer, as we understand, is an abnormal growth, and it eats into the normal tissues and organs, and it can spread into other parts of the body, including bone, and erode away bone, and so on, cause symptoms in distant places. So we have those two disease conditions, what is called the benign prostate hypertrophy, which we just have increase in the size of the prostate gland. And the common presentation for this would be increased frequency of passing urine. Urgency means when the call of nature comes, for the average ordinary person, you can actually hold it for some time and only relieve it when you want. But the person who has increased size of the prostate, when it comes, it comes. You must give. If you don't, it will get off on its own, because you've lacked that capacity to self-regulate when to pass and when to hold back. Hesitancy refers to inability to start passing urine when you go to the washroom, and you can immediately start passing urine. For the person who has enlarged size of the prostate gland, they have really to sit and wait for some time before the urine agrees to come. In fact, they have to kind of strain to put a lot of pressure for that urine to come out, and that's what is called straining. While the urine is coming out, there is what is called poor stream. You cannot actually have that urine landing far distance from where you're standing. It lands right under your feet and dribbling small drops of urine. That strong stream is not there. So these symptoms may come in various combinations, and all this may be a pointer towards increased size of the prostate gland, and it's causing obstruction. And this can be very nasty symptoms. When this urine does not come out completely, it gets stuck in the bladder. There's a tendency for it to get infected, and then urinary tract infections come on. So this generally would be some of the key things to look out for, to suspect that one may be having increase in the size of the prostate gland. And like I said, the increase in size may be just because of the benign condition or because of the cancerous condition. Next slide, please. So when it comes to the cancerous type of increase in the prostate gland, again, the symptoms would be so much similar, because remember, the basic thing is that there is obstruction. So there's a difficulty urinating, there's a poor stream. But now cancer would have additional things, because the cells grow way beyond the prostate gland, and they may affect the bladder, they may affect the spine around it, or they may even go into distant places. So some additional things like bone pains, or passing blood-stained urine, and maybe poor sexual function and so on may actually be manifestation of cancerous prostate. Then other what we call constitutional symptoms for cancer, losing weight, probably sweating a lot and so on, not directly related to the organ, but because of the cancer nature. So the important thing about picking a disease of the prostate is to do examination of the prostate gland, and this is called rectal examination. Very nasty experience, those who may have undergone it, where the good doctor has to stick his finger up the rectum and feel the size of the prostate, feel whether it's smooth or not, and so on. No two ways about it. This has to be done after a certain age. This prostate examination has to be done repeatedly. You can see my cartoon down there, the second last, about this doctor pointing his finger into somebody's rectum. That is the way the prostate examination is done. The next slide, please. So who these individuals who are at risk of developing prostate cancer? Again, no single factor, but we'll look at many of these. Age, increasing age, the growth of the prostate gland is determined by the male sex hormones, the androgens. So the more we grow, the more androgens we are exposed to, and that gland undergoes growth just in the cell itself, or transformation into a cancerous nature. There's no magic number for age for developing prostate cancer, but any age from 50 years onwards, the risk for developing prostate cancer actually increases. Race has been demonstrated, especially studies that have been done in the multi-ethnic communities, like in the United States, where the black race has been shown to predominantly overrepresent individuals who develop prostate cancer. Family history is important. If you have a brother or an uncle or a father, or who first or second degree relative who has had prostate cancer, the chances of this index individual also having prostate cancer is pretty high. The occurrence of other cancers in the individual or in the family also increases the likelihood of prostate cancer appearing in that individual. Now, dietary habits, no clear correlation of diet and cancers, but generally what has been shown, poor diets that lead to development of obesity can also have a contribution in development of cancers, including prostate cancer or cancer of the esophagus. There are some factors that are not very clear, but are thought to be contributing to the causation of prostate cancer. For example, cigarette smoking, exposure to certain toxins, including chemicals, repeated sexually transmitted infections because of the continuous irritation of the prostate may lead to hypertrophy of the prostate and even cancerous transformation. Now, the issue of sexual activity with the prostate enlargement and cancer is again very unclear. Some cohort groups have shown that individuals who have reduced sexual activity probably have more likelihood of developing prostate hypertrophy and cancers. Others are not. So it's just something to think about, but I wouldn't give you a clear direction that sexual activity in itself will be related to causation of diseases of the prostate. So you give me the next the next slide after that. So I wanted to just briefly talk about erectile dysfunction, and one of the nasty things that happens in men is failure to rise to the occasion, and we know diseases of the prostate commonly lead to erectile dysfunction. They are the street word for erectile dysfunction, libido, failure of engine, and so on. All those can be used, but we know this is a medical condition. It's also a psychological condition. It can lead to a lot of strains and stresses in family. There are many risk factors why erectile dysfunction can develop, and prostate diseases is one particular one to consider. But we have other considerations: increasing age, smoking, excess alcohol use, medications, certain medications, for example, for blood pressure, for sugars, and so on, have been shown to contribute to reduced male hormone levels and can reduce erectile dysfunction. Hormone deficiencies because of some medical problems can also lead to this. Life adjustments, people who generally have stressed lifestyles, working too long hours, doing difficult jobs, and so on, can actually lead to erectile dysfunction. Of course, some forms of surgeries that especially affect the nerves in the groins and so on can lead to erectile dysfunction. So these are important, especially when we're talking about individuals who are getting treatment for diseases of the prostate. The key treatment actually for diseases of the prostate, like I told you, the prostate enlarges because of increased male sex hormone. So the treatment is to kill that hormone, to reduce that hormone. And of course, when you're reducing that hormone, goes without saying, the likelihood of having an erection and so on gets less and less. So as we are treating diseases of the prostate, we should be ready to know that we're actually feminizing that individual and erectile dysfunction would set in. Next. So some of the general recommendations to tackle when it comes to management of cancers and prostate cancer in particular. Diet, I did mention there's no clear, straightforward correlation of diet and cancers, but generally if one can keep healthy diets, keep your sugars low, keep your carbohydrates, keep your lipids low, avoid obesity and heavy weights, and this to an extent can actually help a lot in preventing development of many diseases, including cancer and cancer of the prostate. Smoking cessation is important. Moderation in intake of alcohol. Having regular health checkups. When it comes to prostate diseases, there are various bodies that recommend different things. The associations, for example, the urologists, these are the guys who deal with the diseases of the male sex organs and so on. They would recommend, for example, having a regular checkup of your prostate after the age of 50 years, every 5 years. If you do not have the disease, or if you have anything suspicious, then the frequency will be a lot more than just once in 5 years. And during most of the regular checkups we do these days, even if you're coming in for blood pressure management or sugar management, would generally do a blood test to check if your prostate is okay or not. We do not always do the finger examination for those who do not have symptoms. Then we can have the screening, and screening basically means looking at all individuals on a general population to look at to do certain basic tests and find out those who may be having a risk of developing a certain disease. So there is a test called prostate specific antigen, which we generally run for most males after the age of 50 years. If it's elevated, we would suspect either there is a prostate enlargement or prostate cancer, and we'll follow it up with other tests, including ultrasound. Rectal examination would also come in handy, especially those who may already be having symptoms. The finger actually helps to just pick the size of the prostate and determine whether it's just the enlargement or it's cancerous, and specific treatment will be given. A lot of support groups are actually important in helping people to come to terms with a lot of their diseases. You share knowledge, remove a lot of myths and misinformation about some of these diseases, and these support groups, either by patients themselves or organized by the various health societies that deal with the diseases, are actually important in helping management of these many conditions. Next. Is that the last slide? Okay, it's just something small on diet. So this would not just apply to cancers and cancers of the prostate, but as a matter of reducing many of the non-communicable diseases. Reducing the amount of saturated fat is important. Increasing fiber in foods is important. Limiting alcohol. We usually have some of these recommendations: moderate alcohol, referring to 1 or 2 drinks per day for men, probably half of that quantity for women. To thought the women handle the alcohol less favorably than men, so men were allowed a little more alcohol than women. This may not be entirely true, but you could take that. Then increase in intake of omega-3 fatty acids, just generally shown to improve immunity of the body and even reduce the likelihood of developing diseases, blood pressure, and so on, and even development of cancers. Next. Okay, so that's it. So in a nutshell, I just wanted to share that, and I'll be happy to take up questions or comments from those who have logged in, and can just have a discussion and see what you understand about the diseases of men, cancers, prostate cancer in particular, and to demystify some of the issues why men do actually fare on worse when it comes to medical conditions, and what we can do to avoid this. And this being September Prostate Cancer Month, we would like to raise awareness and encourage those who have symptoms, or those who generally are in that age category, 50 plus, please go for screening. It's just a blood test. A PSA can be done. If your health practitioner thinks there's something additional, then a blood test or even digital finger examination or an ultrasound can be done, and you'll be advised accordingly what needs to be done. Thanks, and I'll be happy to get the comments.
Thank you so much, Dr. Bernard. That was very insightful about prostate cancer. So if you have any question, you can raise your hand, or you can chat it on the chat box. As I go back to the previous slides, someone had requested for a slide on the slide on diabetes. So I'll be projecting that as you prepare to ask any question that you have. Alan, I can see you have a question. Just unmute and ask kindly.
Yeah, morning everyone. Okay, so my question is based on the fact that many people, they know some lifestyle habits like smoking, alcohol, lack of exercise, all those reduce the likelihood of getting cancers, but still they engage in such activities. Are there like programs or initiatives that can be implemented to help these individuals live better lifestyles, plus to prevent the probability of cancers as they grow old?
Okay, thanks, Alan, for that. Excellent. Now, some of these issues are actually very complex, as we understand, and the mandate of any organization over individuals really varies a lot. So there are various levels of organizing activities. These are public health measures that cut across. They do not target any particular disease, but in the long run, they may have a positive impact in reducing multiple diseases. Right at the top, for example, in the country, we have the Ministry of Health that has certain key goals every year or every term, say 2 or 5 year term, of reducing certain aspects. For example, there are pressure groups that are working towards reduction of smoking, tobacco smoking. We have pressure groups at the ministry. We have professional organizations that are working with the communities or with the individual patients, those who want actually to stop those habits, those who are already engaging in the habits and want to be helped. So those are going on. So multiple levels of approaching cessation of cigarette smoking, alcohol moderation, healthy lifestyles, avoiding sedentary lifestyles, dietary habits. So I wouldn't say one particular one. We have public health information at various levels, including the radios, televisions, and messages put on our social media. And what I would also say, each of us as an individual who understands something and the benefit of any of these measures, you have actually a responsibility just to pass on that information to your immediate neighbor, to your family, or whoever cares to listen to you, so that we all get into this train and be able to support each other. Thanks, Alan.
Okay, thanks. I have 2 more questions.
Yes,
You mentioned that there was a paper that stated that about 30% of deaths are due to cancer.
Yes, go ahead.
Might you remember the name of that paper?
So I'll give you the citation, but usually we have the health and the demographic surveys that are done in the country every 2 years. So I don't have the particular reference, but generally, if you look at the Kenya health and the demographic surveys, should be, I think the last one was done a year or 2 years ago. That was it shows what diseases are most prevalent and what percentages, and compared to some 5 years back. And so, yeah, the health and demographic survey of the country.
Okay, so my last question is on the prostate tests. From hearsay, I get the idea that prostate tests are not very friendly for men. Is it something that is true, or it's just gossip?
I'm sorry, I didn't get you. I think your line went.
Sorry, the prostate examination.
Yes.
For most men, they find it, for the lack of a better word, intrusive.
Yes. So you know, the examination of the prostate gland is actually very uncomfortable for men, and we are getting more and more technology these days. For example, if 10 men of the age of 60 years are coming out there to see me, one thing I would want to look at symptoms. Who has the symptoms? Those who have symptoms are on my high list of index of suspicion. Next is a blood test called PSA. Who has a high PSA? They will be next on my list of suspicion. Then I could easily send them to do an ultrasound. Unfortunately, the ultrasound is also done through the rectum, so there is a small gadget that is pushed down there to do the examination. So whether I'll be using my finger or I'll send you for an ultrasound, we somehow have to access it through that end, and it's a very unfortunate thing. But that's the only way we can actually be able to assess the prostate, by virtue of where it is sitting. That's the only access we have to approach the prostate.
Okay, thanks.
Okay.
Another question that has come through, Dr. is What if it's about alcohol? So if I take a couple of bottles over the weekend but don't take during the weekdays, does that position me as a high-risk person to have prostate cancer?
Yeah, of course, the recommendation of a certain amount of alcohol per day. So one of the reasons, suppose I accumulate all that and take it at one go. Maybe it may not, because there's some of these things are cumulative. The injury to the body or to the liver from things like alcohol and so on are cumulative. So if you're taking that weekly recommendation at a go, maybe it may not harm you that much. It may just be as good as spreading it out. But remember, the tolerance at that particular time may not actually be good enough, and people end up with what is called binge drinking. Don't drink for a long period of time, then on that very good weekend you take excess amounts, and the long-term effects may not be there, but there are some acute complications. Even some people get convulsions, get low sugars, hypoglycemia. Some of them can even cause accidents and so on. So I wouldn't really encourage that one accumulates their whatever figure they are supposed to take in the week and consume at a go. It's easier or better, healthier to consume them spread out than having it all accumulated and taken at a go.
Okay. Before I go to the next question, Caroline, kindly ask your question. You can unmute yourself. Caroline, you can hear us? Okay. I can see her hand is up, but I can ask the question. How is erectile dysfunction related to prostate cancer?
Okay, so the various levels at which we can look at the basic principle for development of prostate diseases is increase in the male sex hormone, and this is good for the sexual function. But like any other cancer, if a cancer spreads and affects the nerves, especially the nerves in the groin, these nerves are important for erection, they're important for ejaculation and so on. Once you have disturbance in that nerve function, then erectile dysfunction can actually set in. The other one to look at is repeated infections in the urine because of obstruction of the outflow. Urine can actually, in the long run, affect the functioning of the male sexual organ. Then the more important thing is the treatment for prostate diseases, whether cancer or BPH, or that's the benign prostate hypertrophy. The drugs particularly target the pathway of reducing the male sex hormone so that the gland does not grow. And this goes without saying that we are actually killing the sexual drive for the individual. So the likelihood, once one is put onto the treatment for prostate cancer or prostate hypertrophy, they're going to end up with some form of erectile dysfunction. So there are many levels of interaction, but basically you look at it in those multiple levels, and in the long run, these people will need support to improve at least the sexual drive while they're on these forms of treatment.
Okay. Any contribution of hereditary or genetic exposure to prostate cancer, and can screening be done earlier than 50 years?
So there are those who maybe have done a lot of studies at genetic level and can actually point towards some genetic markers that predispose an individual to future likelihood of developing prostate cancer. I didn't want to go into all that, those the genetic locations and so on. But what has been shown is the occurrence of prostate cancer in close family member, first or second degree relative, as first referring to brothers or cousins, father, and so on. The index individual is probably carrying some genetic materials that would also make that vulnerable to getting prostate cancer. Then as an individual, there are certain genetic markers that have been studied. But again, these things are not 100% that once one carries that genetic makeup, they will get the disease. So there's a lot of interaction, the genetic makeup, the